Hi, part 2, medical emergencies. Turn to that in your first aid book. The first one is talking about breathing problems. They go into asthma. I'm sure that even a few of you have asthma, so you might have an inhaler. Some of you haven't seen this before. An inhaler, right? Put it in your mouth, squirt. But the problem is that many times when people are doing it, it goes to the roof of their mouth and they don't get the medication. So you might have a spacer. With the spacer, you put it in, and when you press down, the medicine will be in the spacer so that you can slowly inhale the medicine. You are going to see this mainly with young kids that have been first prescribed inhalers, or maybe the older population that hasn't learned how to use an inhaler yet. So be aware of that for the breathing problems. You might also have a breathing problem of choking. If we have two different trainings, we have the American Heart and we have the Red Cross. I'll do it this way. AHA is American Heart Association. ARC is American Red Cross. They do have a difference between the two of them on the choking curriculum. And what American Heart, which this is the book that you're working with, is going to say that you do abdominal thrusts. American Red Cross, as I like to say, is going to do what grandma would probably do, and that would be whack you on the back. The protocol for Red Cross then is 5 back blows followed by 5 abdominal thrusts. American Heart Association is going to be 5 continuous abdominal thrust until the person either the choking object is dislodged or they pass out and become unresponsive. Then you would go straight into chest compressions. Did you hear me? You go straight into chest compressions. You do not check for breathing in a pulse. You're going to start pushing on their chest, and then you will breathe for them. So those are the new curriculum that came out, I think, in 2015 for how to handle choking. I will show you a little bit more once we go into the BLS book. Allergic reactions. People have allergies to many different things. Think of a few things. You have nuts, you have, I've heard of eggs, bee stings, and so you have a problem. Or like my grandson just got diagnosed over Christmas for, what was that, shrimp. So you get an EpiPen, and you will read in there a little bit. This is another skill that will have to be practiced in order to get a certification. But with the EpiPen, you want to make sure that you grab it a fist, and then you take the safety cap off, and it's going to go in between the knee and the hip, right along, I like to say, right where your seam is, and you just put it in and press, and it's automatic, so it will drive the needle into the leg. Then you hold it for 10 seconds, and then slowly take it out. Now look at the EpiPen. It will cover up that needle so that you can give that to the paramedics. Everybody is now prescribed 2 of these, and they should keep them together, because if the person is still having allergic reaction, the hives, the difficulty breathing, then going into anaphylactic shock, you might have to use the other EpiPen if the paramedics don't get there in time. So just being aware that the hives and all these things, and this will be something too that we will practice to get certified. Heart attack, they talk about heart attack in the book, and how there's different signs and symptoms that you're going to see with a heart attack. Uncomfortable feeling one or both arms, the neck, the jaw, or back between the shoulder blades. The longer the person with a heart attack goes without treatment, the greater possibility of damage to the heart muscle. So what we need to do is make sure that they get in there to get checked out as soon as possible. One thing that we can do as first aid responders is give them aspirin. You give them 1 regular aspirin or 2 low-dose aspirin. They chew it, put it sublingual, which means you put it under the tongue to have it get into the system faster. Even on the book, in the video for the heart attack portion, it does show that they swallow the aspirin, but from paramedics that I had talked to. They said it's a little bit better if you can get it acting faster in you. And it's aspirin. Unfortunately, you're gonna find people that think Tylenol and ibuprofen and aspirin are all the same thing. They aren't. This is aspirin for heart attack. Fainting. In the past, we used to say if somebody faints, you want to raise their feet up. And now they say they want you to lay flat. You are still, if you're going into athletic training, going to learn about times where you will manipulate the body if somebody's fainted to raise their head or raise their feet, but we won't in our generic first aid be doing that. We want to look at it. If they faint, keep them down and keep them flat. Diabetes or low blood sugar. What you want to do is you might want to even have this in your first aid kit. You can have glucose gel, or even a honey packet, or Skittles, or something that has sugar in it. Your first aid kit supplies, give you some ideas, is on page 79 in your book. You can look at that, and I think I do have a question on one of the quizzes that you do online for Canvas of what can you put in a first aid kit. So you could have this, you might have some aspirin, things like that to work with somebody that is diabetic. Stroke, there is a acronym to remember for stroke, and that is FAST. F is for face, A is for arms, S is for speech, and time. One side of the face will droop. You don't have the muscle control in one of the arms. The speech will become kind of slurred, especially if somebody, to me, I kind of explain it if someone has gone to the doctor and had Novocaine and it just kind of lost some of the elasticity on that side of the face. It's going to be harder to have a pure speech. And time. You want to note the time that all of the symptoms first started. The last thing that they talk about in here is seizure. Grandma is going to want to do what? She's going to want to put something in the mouth so that they won't swallow their tongue. They can't swallow their tongue, okay? It's hooked. So you do not want to do that. You want to put them down. You do not want to hold them down. You do not want to stick your hand or anything else in their mouth and let the seizure expire, and then you might, depending on how bad or if they got hurt or if they're starting to bleed, then take care of those secondary situations. So this is done with part 2. You may go to your questions at the